As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, let's camera action, I'm ready to go. I'm never gonna give up.
You're listening to the Tom Ficklin Show on WNHHLP 103.5 FM, your home for community radio.
Well, you know what? I am extremely excited. I don't think you really know how excited I really am to actually have the guest that I have on the show today. Meeting for the first time face-to-face on this call is Dr. Margi. And then I have just my great friend, Dr. Leslie Sue, on the call today. I'm excited because, you know, a lot of times we really don't understand pediatrics. We don't understand what actually happens in pediatrics as it deals with how doctors approach parents as it relates to certain topics. Because we're still in a very serious pandemic, sometimes we put that concern to the side. And it's no better place to be than to actually have those that are actually dealing with this side from the medical side to give a better understanding to parents as they are approached about vaccinating their children, and also dealing with very serious medical equity situations in our community and how to help us get past those things so people can focus on the very serious things. And that is actually making sure your children are healthy at home, as well as in school, as well as in this environment. So first of all, I want to take the time to just thank Tom Ficklin for allowing us to come on the show today at 103.5 FM, WNHH. And also, I always forget to thank the one that also makes this happen for all of us, and that is Harry. Harry is the one that controls everything that we do. So I send much love out to him for being with us today and helping us to put this message out to the community. I wanted to call the show today, Remove the Cloud from Over Our Children. COVID is still here. And I don't want people to get mistaken that COVID has just gone away and we don't have to worry about it anymore. That is not true. It's so many things that affect our children that we put to the side, or we take as something that's not as concerned, or you too overly concerned that you're not properly getting your children looked after medically when you're very hesitant about things you don't understand. By now, we've been in this COVID series, this COVID pandemic for over 2 years. So there should be some form of understanding about it. So before I get too excited, and not allow these beautiful doctors to come on and let you know who they are and what they actually do in the community, I'm just going to start with Dr. Margi and let her, because she's the new one on the block, and let her come in and just tell you a little bit about herself and actually where she practices and anything else she would like to share.
Sure. Thank you so much, Bernard. It's so nice to meet you and so nice to be here. So my name is Dr. Luba Margi. I'm originally from Binghamton, New York, and then I moved to New Haven just about a year ago now. I am a pediatrician in training at Yale New Haven Hospital. And then I also work at Fairhaven Community Health Center as well. And yeah, I'm just really happy to be here and to talk about how we can be safe this summer with COVID.
Hey, I can't wait to hear it myself. And none other than my gracious friend, Dr. Leslie Sue.
Bernard, you're just like the nicest gentleman in the entire world. And I'm just so grateful for knowing you and having worked with you over the past 2 years.
Pleasure.
We've done some unbelievable things together from the very early, very dark days of the pandemic. Throughout New Haven, throughout the community, and you've really embraced our work, and we've also embraced yours. You have helped us talk to the community in our efforts to get the word out about how people can take advantage of things like PPE and vaccination to keep themselves, their families, and their communities safe. I'm Leslie Sood. I'm an associate professor of pediatrics at the Yale School of Medicine. And with Dr. Marjai, I also work at Fairhaven Community Healthcare, seeing general pediatric patients.
As you see, she's everywhere.
Yes, and well, and the other work that I should probably just bring up is that I also work with the Yale School of Medicine Community Healthcare Van, which is a mobile health service. We originally did work focused on harm reduction services to reduce the spread of infectious disease throughout the community. Since 1993, many people are familiar with the big blue bus that goes into various neighborhoods and provides a number of services like testing for HIV, hepatitis C, distribution of clean needles for those who inject drugs, distribution of condoms and safe sex supplies, anything that the community needs to keep themselves safe and from transmitting diseases. But recently, as you mentioned, with the pandemic, I joined the team to provide mobile health services to newborn babies and moms, and to do some focused lactation or breastfeeding support at the door side or the curbside to moms who are recently discharged from the hospital with newborn babies.
As you can see, New Haven, what's actually happening under your roof, and a lot of times is missed only because, knowing Leslie, she don't put herself out there like that. She really cares, so she's not looking for the publicity. She's actually doing the work. And to me, that's different than some people we deal with in our lives that actually just look to be promoted and people to know who they are. That's not Leslie. So that's a lot of times that you miss those things because of that. So I'm so gracious she was able to share that with you. Just quickly, if somebody wanted to receive, before we get deep in this conversation, Leslie, if somebody wanted to receive home curbside services, kind of who do they need to contact?
Yeah, they could give a call to the community healthcare van. Why don't I quickly get that phone number up for you? We do have a number and they could get in touch with us. Anybody would also be welcome to send me an email, leslie.sood@yale.edu. But we have a phone number and people can ask for a visit. You're out there wondering if you're breastfeeding right, if your baby's getting enough. You want to get a COVID vaccine, or in the fall, a flu vaccine for you, yourselves, your family. You want your baby checked. You want to have your blood pressure taken because you knew there was maybe a problem during pregnancy that you should be following up on. We'll be there and we can come and help you out.
And
Uncle
trust
Ken.
me, people, they will show up. Believe me, I was actually there and I witnessed it with my own eyes. I'm just going to jump right in, if you all don't mind. When I'm looking at society today and things that are happening to our babies, that even at this very moment, I really still don't understand the mindset of people that will walk into elementary school and begin killing kids, walk in a grocery store and go over 200 miles just to take lives of people that had nothing to do with whatever this person's mindset was. But in this frame of mind, it just concerns me because it's like people have no concern for the welfare and the livelihoods of others. But when people start harming children, that even affects me even more because I have kids. And I don't know if you all have kids or not, but I have kids. And having children, it scares the mess out of me that I could send my child to school and they might not return home. That even scares me even more because as a medical professional, as I am, and as you are, it concerns me when you have a virus in your community that may not affect all the way that it affects some, but it's always that one child, there's always that one adult that might not come out of this. That's what concerns me. And so if one is lost, then we are lost. I don't want to lose one child to the mistake of a bad decision. So that opens up the door for me to ask you, Dr. Marjai, when you began dealing with COVID, what were some of the things that you would say to your parents to help them to really understand the significance of this virus?
Mm-hmm. Yeah, thank you, Bernard. So I think the first thing I talk about with parents is the fact that COVID at the least is an inconvenience, but at the most, it can cause serious, serious harm. This year, we have seen children hospitalized due to COVID. We've seen them in the ICU and intubated due to COVID. And then also there's the fact that in children, it can cause multi-system inflammatory disease, MIS-C, which can also be very serious. So these are all things that I sort of talk about with parents when I talk about the importance of getting the COVID vaccine, both for themselves, but also for their children to protect themselves and their family from all of these different things. And sometimes parents will ask me, they'll say, oh, but like, what if I still get COVID? Like, is it really going to protect me? And the thing that I always tell them is, if you still get COVID with the vaccine and you're able to stay home, the vaccine did its job, because you're not in the hospital, you're not in the emergency department, you're able to stay home and you're protected. So those are all sort of the things that I talk about with families when I'm talking to them about the vaccine.
You know, being a upcoming pediatrician, you know, how do you deal with hesitancy in your own family? Because, you know, hesitancy amongst Black and Brown people sometimes is highest, only because of other things that we deal with in this world, and we put everything in one box. You know, it's against us. That is the word that we use a lot. This is something else that they've come up against us. How did you deal with that in your own home?
Yeah, absolutely. So I think for everyone, everyone has different reasons for their hesitancy. In my family, it was mostly the idea that Black and Brown people have been continuously experimented on historically. And that is a large source of fear, and in this vaccine as well. I talk about the fact that we have also, as a community, been affected by COVID more. The Black community has been had more serious disease, been intubated more times, been in the ICU more than other communities. And that is why it's so important for us to protect ourselves. We have an opportunity now to protect ourselves. And my family personally is from West Africa, and they don't have access as we do in the United States. And that's why it's so important now that we have access to the vaccine here, and it's so readily accessible. That's why it's so important for us to protect ourselves as much as we can. So.
That is such a great answer. It leads me to think about when people that are not vaccinated, you know, or people that get vaccinated, people that get vaccinated, is there anything that they need to be concerned about as it relates to the vaccine? Because there's a lot of rumors out there. And believe it or not, after 2 years, some of these rumors still exist. You know what I'm saying? What would you say to people as it relates to being vaccinated versus to not being vaccinated? What would be the difference in your opinion, especially now that we're coming into the FDA approving from younger kids now to get vaccinated?
Yes, definitely. So yes, and that's really exciting news that we're going to be able to possibly start vaccinating kids under 5. In terms of like rumors, or I think there's a few things. So one of them is the sort of syndrome for heart inflammation associated with the vaccine for kids. That's something that we've heard about and seen, but it's been extremely, extremely rare. And the children that do get it are largely fine. They don't need, they haven't needed any medication. They have come out of it largely unharmed. Whereas we know that kids who have COVID infection and then get heart inflammation from COVID infection itself, or get the multi-system inflammatory syndrome, they are more, they have longer hospitalizations, they have longer effects and complications due to COVID. And then in terms of other rumors that I know there's like the microchip and things that I've heard, and those things I can't even trust. But
that one was crazy.
Yeah. Yeah, but mostly like in terms of safety, the vaccine is extremely safe, and vaccines have been protecting us for so long now. There are so many diseases that have been completely wiped out due to vaccines, and they're so important to our community.
Thank you. Hey, you know what? As much as I don't want to leave Leslie out of this conversation, Doc, when your guys are out in the community, they hear a lot. You know what I mean? What's come some of the feedback that you've gotten from some of the moms from your mother's program as it relates when Leslie is talking to them about vaccination, as well as what she does for them with breastfeeding?
Oh, you're talking about our friend Liz. Yeah.
Liz, I'm saying Liz.
Yeah.
I'm sorry. Don't tell her I messed up her name.
You know, I think that, just as was just mentioned, there's, still some of these, we're not hearing so much about the original myths of, or stories and misinformation about the chip and whatnot. I think what we're getting the feedback about now is that you can still get the vaccine and still get the disease, right? I'm recovering. I'm on day 11 right now of my own COVID infection after, the primary series and a booster. And then people say, well, the vaccines don't work. Well, that's not the case. It's not that the vaccines don't work. It's that we are in the midst of a pandemic with a virus that's able to keep changing itself. So what we've all been vaccinated against is the original SARS-CoV-2 virus. But what we're seeing circulating through the community is it's like great-grandchildren, if you will, different new versions of it. And it's the current circulating versions of the virus weren't included in the vaccine. However, the good news is that some of the core components of that original virus are still relevant in the current versions of the current virus. So you still get some protection, some very important and meaningful protection from the original vaccine, even though we're seeing a distant relative of that original virus. With time, and that's what's keeping people, as Dr. Marjai says, home and out of the hospital and not getting severely ill. We can't say to anybody that you're not going to get COVID. Probably everybody will, vaccinated or not. It's the question of how sick are they going to get and what complications of that illness will they get. And those who are vaccinated seem to be doing much better with it, even though they're still getting infected.
I can speak for myself. I'm one of those people. I mean, I got COVID probably in February, but I believe being vaccinated, being boosted, mine was very mild. It was a very mild experience. And I have a pre-existing medical condition. I'm diabetic. So I'm always thinking that if I was not vaccinated at the time that I caught COVID, what the difference could have been. And that's what scares me now as we approach, how do we deal with normalcy? And what is normalcy for the summer for our babies as it relates to still dealing with this devil, I call it the murderer. Sorry, excuse me that I'm so strong with it, but I want people to look at it the way that it is. We're not back to normalcy. How do we relate that, Dr. Marjai? How do we relate that to our parents as it relates to their kids and keeping their kids safe? I've seen people out there picketing, and I don't want masks, and I don't want my kids to have to do certain things I just want them to go to school. Mm-hmm. But sending them to school into an environment where we still have COVID issues. How do we get that across this summer to these parents to help them to prepare their kids to go back to school?
Mm-hmm. Definitely. I think what we're seeing from a lot of parents is that they're seeing the effects of COVID and the pandemic and the social isolation in their children. The COVID pandemic kind of exacerbated the mental health issues that were already sort of existing especially among our adolescent population, but among all children. And this sort of want to return to normalcy, want to return to sort of socializing, not quarantining, is all sort of tied into that. So I think the idea of, like Dr. Sood was talking about before, harm reduction, reducing, like having people able to sort of socialize, but doing it in a safe way, as safe as possible, is sort of the way we should be going towards. And one of those things is wearing masks. Masks is one of the best ways to protect ourselves. And that is important to sort of emphasize, especially in school when kids are together. And then another thing is washing your hands, which is something that we've always talked about. And then also using the home COVID test and sort of using that as another way to sort of protect yourself and protect your family. I think it's a tough conversation. I know parents like really want to go back, but there are ways that we can sort of do this in steps to really make sure that everyone is safe.
And you say to do this in steps. That is kind of a great point. Kind of what would be some of the steps that you might want to take or they might want to take?
Yeah, so I think one of the things is like knowing the difference, like when you're outside, you're less likely to get COVID versus when you're inside. So maybe when you're outside and you're and it's a safe distance, you can take your mask off and socialize versus when you're inside and wearing a mask. Or another way is using the rapid test at home to test yourself if you have if you're symptomatic and staying home. Yeah, those are the things that I sort of like think about when I think about staying safe.
Wow. All right. Dr. Sood, do you think there's anything else that you would add to that?
No, I think that she stated it really perfectly. I think, you know, the other thing that we as individuals are going to have to do really on a continuing basis is just assess our own risks. Who do we live with? Who's in my house? Does grandma live with me? Or is it just me and my partner? You know, how healthy are we? Can we handle a COVID infection on top of our vaccination and boosted status? Or are we very, you know, vulnerable? And then we got to think about our kids, right? You know, where are our kids going? Who are they going to be with? And then who are they going to come back to when they come back at the house? And everybody's going to have a different story and a different tolerance for risk taking and a different set of consequences if they do get sick. And it's very hard to make, you know, universal, you know, in the beginning we were everybody mask and but now we're going to have to kind of, you know, I agree. I think we should still stay masked as much as possible if you want to avoid getting this virus. And even in the current version of it, it's a no joke virus. I was really, really sick for a week and a half and still feeling very knocked out from it. So I don't take it lightly. But some people are going to be able to get that virus and roll with it, and others it could devastate and disrupt their home life, their kids' ability to attend daycare, and the person who has the illness ability to go to work. So it has financial social consequences as well as health consequences and economic consequences.
You know, it's a couple of things that both of you said that I kind of want to stay on. And I'm gonna come back, Dr. Majai, but it's something you said, Leslie, that you still, Dr. Sood, that you still want people to understand the importance of masking. And that the mask is not a virus in itself, or the mask is not going to cause harm. When I look at all, like I mentioned earlier, when I look at all the people fussing and signs and mad because their kid has to wear masks, how do we really influence our parents the importance that this is a very important thing to protect their kids, not actually it's something that's harmful or they're made to wear these masks, but we're actually care enough about them to protect them from themselves. Why do you think wearing this mask is so important? Because then that's going to come back to Dr.
Look, I'll
Martin
just
when it
say,
comes to mental health.
2.5 years into COVID, I have vaccinated all over New Haven. I've been in the office. I've swabbed people who later tested positive. And I thought to myself, that's it. This is when I'm going to get COVID. I never got COVID wearing my mask. I went to one little party outside, mind you, talked with somebody up real close and personal, wasn't wearing a mask. That's my COVID.
And boom.
That's all I needed. That was my study.
I love that. Parents, I hope for the parents out there that's following Tom's show today. Oh, by the way, I didn't introduce myself. I'm Bernard Macklin. I'm the coordinator at Southern Connecticut State University Care Program through Southern's Department of Health and Human Services. But when I think about, what happened to me, when I think about what happened to people in my family that didn't make it, because I've lost some family members to COVID early on. And when I think about people's opinion, when it relates to how this affects me, sometimes we think our children don't have feelings. We think our children don't have emotions. And something you said, Dr. Margai, to stay with me, you mentioned mental health. How does this whole pandemic, in your experience, when you was going through it over the last couple of years, how is this thing affecting the mental health of our children that come into your office or people you've dealt with, children, families you've dealt with?
Yeah, absolutely. So it has primarily been two things. So the sort of social isolation, the inability for kids to sort of see other kids and interact with them has been particularly hard on the children that we see in the office. The other part has been sort of school is now back in session, but before having the sort of electronic school, so many kids were having difficulties in school when they hadn't before. And just sort of the Zoom learning environment was very difficult for them. And then children who had sort of underlying history of depression and anxiety, that was just severely worsened during the pandemic. And then what we're seeing now is that there's sort of there's so few mental health professionals, and there's long waiting lists. And it has been extremely hard, the pandemic, on just finding mental health resources for kids and making sure that they have everything that they need to succeed. Yeah, it's been difficult.
When you think of how this affects kids when it comes to wanting to harm themselves, because I heard that those numbers had increased, and I really want parents to really understand how all of these things affect their kids, because they really don't understand what's really going on, like we do as adults somewhat. Depends how deep you go into and research this thing, but we have a different understanding of it than our children. And I really want parents to understand the significance of this and how this really affects their kids. And I'm hearing now that certain areas in the state, certain cities in the state are fighting to get mental health services in the schools. How important, do you think that is from the medical side, that they actually have something in the schools or something in their neighborhoods that these kids can connect to, that it really doesn't really affect their mental health? Absolutely.
I think that is so key in terms of increasing the convenience and the ability to, in school, see a mental health professional. That is huge for kids. It is so hard already for families to sort of make it to appointments, and even if they find a therapist. So the ability to kind of have that in school already would be such a game changer for sure.
You know what, Leslie, you said something, Dr. Sue, I'm sorry, I'm so used to calling you, excuse me for calling by your first name on the call, but Dr. Sue, It's something you were talking about that stayed with me. That when you said, I wear my mask and I'm enjoying myself, and all of a sudden I go to a gathering, and boom, I get affected. Well, this summertime is party time. Summertime is when people have their open houses, kids are graduating, and all of those sorts of things. And this is that part I wanted to get into. They are we going to the party? You know, we're gonna have a good time. What would you say to the parents that are planning these events for their children, which is grand things? I mean, I had an open house when I graduated. It was the bomb. I enjoyed myself. But we're not in that sort of situation right now. So kind of what would we say? I mean, to help them to really understand, yes, you can have it, but you know, what should they do to protect the kids that are coming, to protect those grandparents that want to hug their babies? You know how grandparents, oh, that's my baby. Oh, I'm so happy for, you know how our grandparents are, you know, and well, I'm a grandparent myself, but anyway, I know I don't look like it, but anyway, what do you say to the parents to really help them understand summertime is for fun for these kids? They're out of school, they want to get buck wild. But is this a buck wild still environment that they're in? And what do we say to these parents to help them that the planning portions, what they should be doing as it relates to their babies and their babies' health?
Yeah, Bernard, you know, people are going to do what they're going to do. You know, at this point, it's very difficult. We can't go against the tide of, you know, human behavior and the forces that direct folks to make the choices that they make. We do want people to enjoy themselves. We want people to, you know, be able to lift themselves out of depression or isolation. We want all that. What I think I'm at the point of saying right now, with the current wave of Omicron that we're in, the BA.4.5, whatever it's called, is that you're going to probably get COVID. If you go to a large gathering, outdoors, indoors, you're up close. I was outdoors, you're up close and personal with somebody, you're going to get COVID. Most likely, at least your chances of getting it are very high. If you haven't been vaccinated, or if you haven't been recently boosted, or even if you have been vaccinated and recently boosted. Lots of stories of people who just got their second booster and still getting COVID. That's not where we're at right now. I don't think we can completely contain the virus. But if you really don't want to get COVID and bring it and give it to a loved one, like the grandma who wants to come and celebrate, then please make sure that they are appropriately masked with a well-fitting mask that sits over the top of their nose, not below the nose, not below the mouth, not below the chin, preferably a K95 or equivalent. And that people don't get right up into their faces to talk, which sometimes is difficult with the elderly who need a little extra support in having a conversation as their hearing diminishes over time. I'm not here, I don't think any of us are here to say that there's a way to completely stop COVID and that we need to go back into full isolation. It's not how they're behaving in other parts of the world. My daughter is in Europe at the moment. She says it's like normal times there. But people are catching these bad colds, and it's a cold plus, you know, it has more neurological and cognitive impact than a typical cold has. People are losing their sense of taste and smell for up to 3 months afterwards, and sometimes in some cases permanently. And I'm one of those people right now. I'm not smelling and tasting at the moment, you know, so I am definitely not belittling this virus, but I'm just saying beware, you will most likely get some version of it. I spent a little bit of time this morning doing some research for another discussion that I was participating in about the benefit of vaccination plus natural infection, a situation that we call hybrid immunity, where you get a little bit of protection from the vaccine and a little bit of protection from the virus. And that seems to be something that people are trying to study. We still don't have full information on it. The good news is there does seem to be somewhat enhanced protection against severe disease, not catching the virus, but severe disease that lands you in the hospital from this hybrid type of immunity. The bad news is we don't know how long it lasts.
And is that another way to really look at the importance of continuing? And let me talk to those parents, those kids that were vaccinated and got both doses, but the continuancy of actually getting your boosters, because from what we understand, this is the cure. The vaccine is not a cure. It's just something that prevents. And we're looking at preventative measures now. And the more and more we use preventative measures, the less likelihood that people are going to die from it. And that's what I don't want. Yeah, we might get a little sick. That's like with any cold. You get sick, you get the flu or pneumonia or any of those other ones, you're going to be sick. I mean, we can't do anything about that. But I want to take it to the point of, loss. Somebody that we could have saved, somebody that we could have protected. And that's what I want parents to really get out of this conversation. And if you've been vaccinated, don't stop getting vaccinated. Continue. Is that something that is a good thing to say to people and to parents?
Yes, absolutely. It is so important to continue getting vaccinated as the booster or additional boosters come out. That's how we stay protected. I believe the studies show that the antibodies from the vaccine wane at about 6 months or so. So that is why it's so important to continue getting boosters as you become eligible.
Now, both of you are at Fairhaven right now. Is that the one on Grand Street? Is that the main office on Grand Street? No, which office are you at?
Yeah, it's at 150 Sargent Drive.
Sargent.
Yeah.
Okay. Now, the biggest thing that I want to take, that I want parents to really get out of this is protecting their kids, to protect their other family members that have pre-existing conditions. Help those understand their kids that also have pre-existing conditions. Am I right?
Absolutely. Kids with asthma, kids with preemie kids who are born early with chronic lung disease, kids with type 1 diabetes. All of these kids are more likely to have more serious effects due to COVID-19 infection. I think there is a misconception that, kids, they get COVID, they're fine, they're asymptomatic. That's definitely not necessarily the case. And kids with pre-existing conditions, like the ones that I named, are more likely to have worsened symptoms, be hospitalized, be in the ICU.
And that to me, that scares the heck out of me. Yeah. And that's why I'm asking the questions that I'm asking and helping people to understand. These are coming from pediatricians that you send your kids to for everything else. You know what I'm saying? And I know we've all found, you probably all can agree that if you trust me with other aspects of medicine with your children, why can't you trust me now as I'm relating this message to getting your kids vaccinated and believing in the science that comes behind vaccinations? Yes, I'm gonna be honest, people. Yes, you can see me. I am African American. And yes, do I have hesitancy issues with some things? Yes. I do, but I'm just going to say to you that this is one thing I don't have hesitancy about. Dr. Marja, being of African descent, how would you relate that to other people of Black and Brown communities, being Black and Brown yourself and providing medical assistance at the same time to this community? Yeah, should they be hesitant?
Yeah, I feel it's hard because in some ways I understand the hesitancy. I understand that this has been, historically, our community has been harmed by the medical community. And in some ways still is being harmed today and marginalized today. I feel like the vaccine is just one of the ways that we can really protect ourselves. And it's hard. It's always been a sort of balance for me. I'm like, I want you to protect yourself. I want you to be safe, and I want you to not have to go into the hospital. And that's typically what I tell parents who are hesitant about getting the vaccine. But it's been sort of a hard discussion trying to sort of get there.
And you know what? Thank you. That is the reason I'm so happy you both were able to make this call today, because it is a difficult conversation. It's going to continually be a difficult conversation.
Yeah.
But at the end of the day, it's a necessary conversation
100%.
that we need to have and continues to have in this community, because these people need our people and everyone in this community. I don't care what color you are. All of us need to work together. That brings up the point that I would like to bring to you. How can agencies like CARE, how can agencies like Fairhaven Health Centers, how can agencies like Cornell Scott Hill Health Center, a community healthcare team that actually wants to provide services out there, Yale Hospital, Yale School of Medicine, Yale School of Public Health, our School of Public Health here at Southern, how can we help and assist our pediatricians to get this message out to the community? How can we assist you? And because it is a difficult conversation, Doc, to both of you, it's a difficult conversation. How can we carry that conversation for you that would be beneficial?
I think honestly, like having conversations like this are huge. Like having a sort of a platform to talk about these things is such an amazing way to kind of talk directly to the community. I think we're already doing so much work with providing vaccines and having them readily available. And then once we are able to vaccinate children under 5, that'll be another way that we can sort of spread the message of trying to protect ourselves and protect the community through the vaccine. I think this is such a great platform to be able to do this. Yeah.
You know what? In this community, I've been told this many times by some adults, and I don't know, is this sort of thing that happens in the community where they're practicing these same practices for kids. But people believe that, plants and herbs and self-medicating, that's not actually the vaccine. But I've been doing this all my life, and I've been taking these herbs and plants and all these other things, not to say that they're not good for you, because I take herbs, I take vitamins and things like that. But when you compare the two, which side of the fence would you basically want to send a parent to, especially when they're dealing with their kids, because they could be giving their kids the same thing? I'm not giving them that vaccine, but I'm gonna give them this herb. Kind of, what do we say to that? Because that's something that came up to me just recently.
Yeah. Well, I think the difference is that the vaccine has been tested among thousands and thousands of children, and there's been research behind it that shows that it's protecting children. Whereas herbs and vitamin, every family is different. And we want to be respectful of families' practices. But the herbs and the vitamins, they haven't necessarily been tested or researched among thousands and thousands of children. So there's not as much data backing them. Exactly like Dr. Sue said, it doesn't have to be either or. It doesn't necessarily have to be one against the other.
And I agree with that. It don't have to be one against the other. But what I don't want people to do is to knock whatever you're doing. If it's working for you, continue to do it. I'm never going to tell you not to, because again, I take vitamins. I use certain herbs for just other things that's outside of COVID. And that's where I want people to get stuck. Is it been proven that it will protect you from this virus? Would it protect you from this new virus coming up, which is the monkey virus? It's not killing people, but I don't necessarily want to walk around with hives and bumps all over myself, looking like I got what they call that old disease back in biblical times, leprosy. I don't want to walk around looking like a leper either. So it's like, it's so important that you really begin to trust the message. So if you are using herbs, continue to use the herbs. But if you need to be vaccinated, take the vaccine that's actually been proven to help you with this particular thing that has nothing to do with other things. It's kind of what I want to send out to the community. I'm just wondering if you agree with that or not.
100%, 100%. The vaccine has been tested amongst thousands and thousands of children in different communities, and has been proven to protect children and adults. So it is so important, even if you are doing or taking herbs or taking vitamins, to also use the vaccine, which has been tested.
It's just make your immune system even stronger.
Exactly.
That's how I look at it. It's just keeping your body stronger. And as these children's bodies are developing, because they haven't developed like our organs, our bodies have fully developed, and we're transitioning to something else now. But these babies are developing, and everything that we can use to ensure that is not interrupted or in any way. Would you agree that this being vaccinated is just one of those things that might prevent some other component or some other infection because you didn't prepare for that?
Mm-hmm. Yeah, no, I mean, being vaccinated, it protects you from, like I said, being hospitalized, from being in the emergency department. COVID can also lead to like having a pneumonia, and so it'll protect you there. Yeah, so being vaccinated, it protects you against so many different things.
It is hard because there's so much that we want to say and so much we want to get out, and it can get difficult. You know what I'm saying? But as we come, we're coming to that time where this time is about to end. Oh, and it went so quickly. I just want both of you, if you can, to take a couple of minutes and just leave this community with a message that they can trust, that they can believe in. Because I'm looking at you, Doc. You look like me, but you also have a major responsibility, and that is protecting the kids that come to see you. What would you say to the parents, and what would you say to these babies as it relates to this summer and preparing to go back to school and just being healthier, period? What would be your message?
Yeah, I think our goal as pediatricians is to have families feel safe and feel and be able to thrive. And this has been such an amazing conversation because the COVID vaccine is one of those things that can really help your family stay safe this summer. We see so many different families with different concerns, but please always feel free to have conversations with your pediatrician like this, have personal conversations with your pediatrician like this. And just wishing everyone to have a very happy and safe summer. Yeah.
And Leslie, bring it home, bring it home. What would be your message to parents that you deal with every day, and to parents that don't have a pediatrician and really don't understand what you do? What would be your message to them as it relates to protecting their babies and keeping them healthy?
I welcome them to come in and get to know us.
There you go.
Because we're there for you. We're there to support families. We want everyone to live their best lives. And we're willing to talk about a whole comprehensive way to do that. You're using herbs, you're using vitamins, bring them in. Let me look it up. Let me tell you what I know about it. But then let me also tell you about a little bit about science and what I've worked so hard to understand for myself so that I can offer it to you.
Let me tell you about science. Let me tell you about the things that you're placing in your body. This is what they went to school for. This is what they research. This is what they practice every day. Just like other people are professionals at their job, these doctors are professionals at what they do. They know what they're talking about. They're in constant research. It's part of their practice. When things change, they go into research it. Leslie is one of the best researchers I know. I've learned so much from her. And now I'm gonna really get to know Dr. Margai now that I've met her. And I'm more for sure she's just as proficient in what she does. If you don't know, go to Fairhaven Clinic, right on Sergeant Drive, have a conversation. I know their time is busy. So if you're going to talk about this, go and talk about this and not bring up 75 other issues, because it's just the way medicine is right now. They got a certain time to talk because they're taking care of patients and they're trying to get all of this information in to provide for you. I'm so happy to have both of you as somebody that I can trust as a trusted messenger in this medical community. We need people like you. This is why I'm so grateful today that you took the time out to have a conversation with me, but also all the listeners that follow Tom Ficklin and his show and anybody else that's coming in. We love you. We only wish the best for you this summer. Live a quality life by taking care of your body. Don't play with such a delicate piece that God created. You take care of your bodies and you do everything that God entrusted these two professionals, medical professionals, to take care of you and your children. Just don't trust them in one piece, trust them in everything, because that's what they went to school for. This is what they believe in, and this is what they do. Tom, we're so grateful to you, man. We love you. The Tom Ficklin Show followers, right here at 103.5 FM WNHH. With that, we're going to let you all go. We say peace to you, but if you have questions, call us. Outside of that, be grateful. Have a wonderful summer.
As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up. Fall down, I just gotta get up, yeah.